A lot of the horror stories that were predicted about how this was going to shoot rates way up and there were going to be death panels and all that stuff. None of that stuff's happened. And in 2 weeks, the Affordable Care Act is going to help millions of more people. And there's no serious evidence that the law, which has helped to keep down the rise in health care costs to their lowest level in 50 years, is holding back economic growth.
So that was President Obama yesterday defending Obamacare and lashing out at critics who are saying that the problems with that there are no problems really, or that there are a lot of problems rather with the law. But we're going to take a look at some Obamacare headlines now from just the past couple of days. Take a look at these. In this month's Health Affairs magazine, a big report from Stanford University researchers on how the feds likely miscalculated health care costs. And then you've got this, quote, Aetna pulls out of Obamacare's health exchange. That was from the December 12th edition of the New York Star Ledger. Or this Associated Press headline, healthcare law perplexing to business owners. Or how about, quote, unions failed to get fix from White House on key Obamacare concern? Or what about the LA Times? Insurers limiting doctors, hospitals in the health insurance market. And this morning we had this one in the USA Today. This according to the Pew poll. Healthcare law faces difficult future. So joining me now on this is Karl Rove, former senior advisor and deputy chief of staff to President George W. Bush and a Fox News contributor. So we've got like dueling realities here. I mean, you have the president standing up there saying, look, there's no death panels, costs are going down. And then you have all of these articles which point to conversations with businesses around the country who are saying, we don't know what to do about this, and our costs are going up. Yeah, look, when the president signed this into law, the average premium for a family of four was $13,375. He promised those premiums would go down 19%, $2,500. As of this month, the average premium for a family of four is $15,745. It's gone up 18%. Think about that, nearly a $5,000 difference from what he promised it would be. So the costs are not going down. When the law was passed, the Office of Management and Budget and the Congressional Budget Office said 3 million people would lose their employer-provided coverage. In February of this year, the CBO said, well, we're going to update that number. It's 8 million people are going to lose their coverage. The Department of Health and Human Services Center for Medicaid and Medicare Services now says nope, that's wrong. It's going to be 14 million people. The Lewin Group, a respected health economic group, says no, it's going to be a minimum of 17.2 million people. McKinsey said we've done a survey of businesses in America and 30% of them say they're going to drop coverage. That could mean the number could be 53 million people. Now then we get into the problem of jobs. If we have a small business that has more than 50 full-time employees and a full-time employee is somebody who works more than 30 hours a week, what we're seeing is a lot of small businesses say we're going to stop hiring in order to stay under that cap. So far this year, we've had an average of 42,500 full-time jobs on average created per month, and we've had 62,100 part-time jobs created a month. That's a flip from what's been the past. And that's evidence. That's evidence. That clearly companies are moving to the part-time model. Right. And you don't need to look any further than the president's biggest supporters in the union, who are the people who are screaming most loudly about this, that the 40-hour work week and work as we know it in the United States is going to be fundamentally changed by this law. We're seeing that. In the last year, the number of people who work 30 to 34 hours a week has dropped 146,500 a month. The number of people who are working 20 to 25 to 29 hours a week, so they're underneath that Obamacare cap, has grown 119,000 a month. So not only are we hiring part-time people, but the part-time people who do have jobs are being told you're only going to get less than 30 hours at this restaurant or this shop. Go find the rest of the hours you need. Yeah. Let's take a look at some of the poll numbers that Fox has out today on this as well, which are interesting. This first one, how concerned are you about your health care under the new health care law? And you've got 43% and 25% together are either very or somewhat concerned about what's going to happen to their health care. And let's take a look at this next one that just came out as well. Which would be better on Obamacare? If you could go back to the 2009 system, 54% say, just give me what I had. They're probably saying I was told I could keep what I had anyway, and that maybe isn't turning out for everybody to be the situation, especially if you're like a Time Warner or IBM retiree who's losing their plan. Then leave the new law in place, 35%.
Now, there are people out there who claim that their costs are going down, and that there are some surveys out there that have been pointed to on this show and others that say, look, no, it's true. What the president's saying is true. The costs are going down.
The most prominent of these is the Kaiser Fund.
Right.
But remember what the basis was. It compared the increases to what the administration had thought they might be, and said in some instances they're going to be, the increases are not going to be as big as you thought. They weren't saying they're not going to be increases. They were saying, oops, you estimated too high, it's not going to be that robust. If you want to see what's going to happen, the Manhattan Institute is putting up a website, has a website up in which you can compare the premium increases that are likely to happen. There are a few states, Maine and New York, where health insurance costs will fall because the mandates inside the Affordable Care Act are actually less robust than the mandates that are already in state law. But in virtually every other state, there's going to be an increase in premiums, and in many states, dramatic increases. Go to Manhattan Institute. They have a map, and you can follow your state. If your state's not yet calculated, they'll have them all calculated when the states finish providing the data this month, but you'll see your state's going to have an average increase that's pretty dramatic.
So we have less than a minute left, but before I let you go, I do want to ask your reaction to this. We talked about with Chris Stirewalt about this at the top of the show. The president's decision to go on yesterday, and to do the economic speech and to lambaste Republicans as part of that speech at the same time as we were watching this dramatic, manhunt was still going on and a lockdown in 8 schools in that area, a mile and a half from the White House.
Whoever said to the president, Mr. President, go ahead and give that slash and burn attack on Republicans today. We don't need to worry about what's going on at the Navy Yard. Ought to be run out of the White House gate. This was a stupid speech by the president. It did nothing to help advance the cause of bipartisanship in solving the country's economic difficulties. I also thought it was interesting. The biggest thing that helped solve the problem with the banks was TARP, passed under his predecessor, implemented by his predecessor, who lent most of the money to the banks. The president would have looked bigger had he mentioned it and given some credit to his predecessor. In fact, he didn't mention it at all. The biggest tool used to deal with the financial crisis, and he let the day pass without a word. He would better off not giving that speech, and he should not have given a partisan speech from the Rose Garden, from the White House on such a day.
Well, there's some reporting today that says that they wish they could have yesterday back, but of course you can't. So we'll
politics.
See if there is an overcompensation now in some regard in order to make that look a little bit better than it did. Carl, thank you. Always good to see you.
Great to see you.
I'll see you soon.
All right.